want to really thank the governor for joining us this morning. Good morning, Governor.
Morning. Morning.
Good morning. How are you feeling this morning?
Feeling good. A little bit maybe raspy in my throat, but feeling much better than the last 3-4 days.
Mm-hmm. And last night what we heard that about the lieutenant governor, just really, I'm still trying to get over what's been happening over the last few days. When we first heard about you, then last night about the lieutenant governor, and then we heard about the legislature, and then with this flight. And we got your message yesterday, and how you're feeling a little bit better, and the fact that you're still working. It's just kind of, for me, I'm like, get your rest.
Right. I mean, Gov,
Well, actually, Saturday and Sunday of last week was where I was completely miserable. Didn't even want to talk to anybody, and was having fever, chills. Pretty scary because I'm usually, my immune system is usually really good. When we're raising our kids, my kids and Jeff would be sick, but I would be very well, of course. And so I was a little bit worried that I was experiencing these symptoms, and I assumed it was COVID positive. Mm-hmm. Because I was already tested last Wednesday, right, with all of my family, and Joaquin, and all of us were negative except him, of course. But we were all negative, so we were just told to stay home and self-quarantine. I could go to work but come back right away, which is what happened on Thursday and Friday. But then Saturday and Sunday was fever, the whole works, headaches. My headaches wouldn't go away. Body aches, no appetite at all. I don't think I ate for like 3-4 days. Nausea, the whole works. And I was a little bit scared, only because this virus could turn for the worse overnight. Mm-hmm. And of course, I'm in that vulnerable age. However, I don't have any serious comorbidities, mm-hmm, so that's a plus. And I just wrote the course of the virus. There's really nothing you can do, only to just palliative, like if Tylenol for fever, lots of fluid. And I did that. And so by Monday, I was feeling better. Tuesday, of course, every day is better. And I had asked Dr. Jolene, who's the COVID expert here, what is the window where if I was going to turn worse, I would turn worse. And she told me I was right in that window when I asked her. But I'm past that window now. And so still recovering, still get tired. This virus I'm sorry, is a bitch. I just have to say, it is just, it knocks you. And I know younger people think that it's not going to affect them, but we have young people in the hospital right now who are seriously ill. And so I just want to make sure that, young people don't think that this isn't going to affect you. And of course, it does not discriminate. You now see all ages, all sexes, all ethnic groups are affected by this virus. It's very, very contagious. Mm-hmm. That for sure. I wear my mask all the time. I'm not wearing it now because I'm all by myself here. Mm-hmm. But I even encourage people. I think where we were a little bit assuming is that in your family household, but I suggest wearing your mask even with family household, because you don't know where all the others have gone, and you don't know where you've picked it up. And so just very very concerning. And of course you're seeing increase these last few days, and our census at the hospital is at 8 which has been that way, but not that way for a long time. So we're very concerned about that. But overall, I think I'm very lucky that I just had what they considered mild symptoms, but for me, very scary. I have not spoken to the lieutenant governor this morning, so I don't know how he is, but last night he was doing okay.
Okay.
You said very, very scary. Did you contract this through I guess a family function? Because I know that Kim came out and the other day confirming that he was one of the 3 that tested positive out of the Bank of Guam.
Yeah. When they ask you to go back and trace your contacts, right? And trace what you've done and kind of figure out when you might have gotten contact or infected. So I think I got infected on Tuesday. Had lunch with my son, and I think that's probably when I got infected. My husband Jeff is fine. He's negative, no symptoms at all, but we isolate ourselves. So
so he's on the couch. Is he sleeping on the couch, Gov?
Now he deserves better than the couch.
The futon.
No, bunk bed.
Oh, bunk bed. Okay.
But I could just imagine, you said scared, and the fact that you have grandkids, and I've heard you in the press conferences how you miss them, and you haven't been able to hug them early on in the first, I guess, wave, and how everybody was on lockdown, right? So I could just imagine what was going through your mind. I mean, I can't.
Yeah. And the worst thing is you don't know when this is going to end, right? So if you knew that, it's only going to be for 2 weeks, then you could probably tolerate it. But it's already, I haven't seen my mom in weeks, and which is good because that's what you're not supposed to do is go visit your. And my mom's 90 years old; she's pretty healthy, but I have not seen her. My daughter's birthday was last week. I couldn't even give her a kiss or those kinds of things that make life better and quality, but can't do that. And you know how we're very family oriented, and it's hard when we see them and we can't even hug them or even just out. It's like our immediate reaction is to hug people, right? And so now when they come to hug, I kind of like just give them an elbow or a fist, and then they get reminded. But it's difficult, very difficult in our culture.
Right, and I think that's part of why we're seeing this community spread is people were just pent up and they weren't able to do these things, and we let our guard down. Gov, we have a lot of comments here. One from Rose on our Facebook live feed, if you don't mind. As you said, Gov, the virus doesn't discriminate. Therefore, please reconsider opening the schools. Another, Gov, think about our school system, our students, teachers, staff. Now is not the time to open the facilities. Eliminate face-to-face. Online for Gov Guam is the best option for everyone right now. I know that there was a meeting Monday. You weren't in it for obvious reasons. But just what are your thoughts on the reopenings of school as we continue to see and anticipate even more of an escalation in positive cases today?
Right. My immediate reaction, and I've discussed this with our team, is to not allow face-to-face and do distance learning. And of course, I think the superintendent is sort of leaning that way. We are going to be meeting today to make a definite decision, but that's where I'm leaning towards, especially if you read in the literature, Chris, I forget which state, I think it was Florida, that there was 117% increase in children getting infected with COVID. So, again, Rose is exactly right. It does not discriminate age. The fortunate thing is most people that have contacted and are younger, uh, its effect is very mild or mild to moderate. So it's not like a older person with comorbidities that then they risk respiratory distress and respiratory illness. But that's not to say they can't get it.
Right.
It's just that they, the numbers, statistics say it's more likely that their illness will be very mild to moderate.
I would say we're just to follow up on that. We're talking about public schools and the possibility of them going all distance learning. But what about schools that have already started? We have a bunch of private schools.
I'm checking. Yeah, I'm checking with my legal counsel because I don't think government has any control over the private schools. But we are in communication with the superintendent, Juan Flores. And, I would also prefer if they all do distance learning because just at least for the next month or so till we start, seeing a downward trend of our positives. And so I probably will see what's going to happen. Yesterday we had 26 positives. The day before, I think we had 16. The day before, I think we had 14. So we're up there. We're going to get information from our physician advisory group today. And looking at the numbers, we're going to look at the last rolling 7 days. I'm suspecting it is going to be high. And I'm expecting our positivity test rate to be about in 2.8. 2.9 maybe, which we have been running at 1.8. So, it is what is happening. I can't really point to any one reason other than what I see is that we are aggressively doing contact tracing, which, with contact tracing, you expect to have positives. We're seriously monitoring these people to see if symptoms occur. So there are people who are positive that don't have any symptoms. And then there's people that are positive that have symptoms like I have. So through our contact tracing, we're finding these people, which is good because then we're isolating them and we're telling them you cannot go out and be exposed. You need to isolate. So that's the most effective way to stop this spread. And of course, people were lax in wearing their masks. And this is why closed bars, Chris, I know people are upset, but that's fine with me. You can hate me, but it's something that I need to do to help resolve our people and to protect their lives and protect our illness and our morbidity in our island.
Gav, you said that you don't have control over private schools, but what you do have control over is establishing the pandemic conditions of readiness. And that's something that, the private schools do follow. Where are you with, and would we possibly see a change in our P-core level? Because we're at 3 right now.
Yeah, we're in 3 right now, and this is where we will make a decision either today or tomorrow. And if we do turn back, we'll probably turn back to P-core 2, and we'll probably close other social gathering places. I'm very concerned about the dining restaurants because that's also a very high risk contagious infection. You see it in literature, you'll hear it, and of course that's because you don't wear your mask because you're eating, you're laughing, you're talking, you're having a nice time. And I love that we're all having a nice time, but we need to protect so we can continue having a nice time. Yeah, so that's a concern for me. Of course, I already closed the bars and I restricted funerals. We saw a lot of traces back to 2 funerals. And then we saw traces to bars. I have to say, though, Sabrina and Chris, that we have some very responsible corporate citizens. And you see this where PROA, I think Crust, Three Squares, I don't remember PROA.
Yeah,
so I
Pro
may be
did.
wrong.
Yeah,
Primo, yeah, Pro did.
Pro
Primo.
Primo Pizzacaya.
Yeah.
Oh, they did. Okay.
Yeah, Calvo, Select Care.
It's a bunch.
There was a bunch, yeah.
And of course, Bagel Guam.
Crab Daddy. Wait, Three Squares, right? Yeah.
Underwater World. We can go on and
Yeah,
on.
no. Long list.
But you're right. These
Yeah,
private.
so that's really good that they're very responsible, which makes my job a lot easier, and of course, which protects our people and our islands. So, and the thing about it, it's already March, right? So March, April, May, June, July, August. It's been 5 going on 6 months,
Right.
and we go back and forth. There's weeks where we may have only 1 or 2 a day, and now we're seeing more. And I hear this, and I read this about the life of this virus, and that the experts are saying that it's going to be an up and down situation. It's going to be like the influenza, where you have outbreaks, then you don't have outbreaks, and so forth. So I think this is what this virus is going to morph into.
Sorry, Gov. We're just getting a release here from the airport. I don't know if you did you get this, Gov? Temporary closure of GIA administration office due to exposure to a COVID-19 case. The AB.
I'm pretty sure I am aware that they would do something like that.
Right. So GIA announces that the temporary closure of the administration office located on the 3rd floor of the main terminal. We've been informed of a confirmed case of COVID-19 in the GIA administration office, stated John M. Kanata, executive manager. Although all employees have been diligent in complying with the wearing of facial coverings and practicing of social distancing in their work spaces, out of an abundance of caution, will be temporarily closing the office until such time public health contact tracing and investigation can take place and sanitation of the workplace is completed to ensure the safety of the employees. So there's another one, Gov. How confident are you? And we just had public health on. I mean, we asked how many different active contact trace investigations were ongoing, and they kind of laughed and said, okay, plenty is what Dr. Maglonia said. So how confident are you, Gov, in public health to really do all this contact tracing? Because it's
constantly coming.
It's overwhelming.
It's a lot.
Yeah.
Right. It's a lot, and because we're getting more positives, they have to work quickly to identify all the other contacts.
Mm-hmm.
I did talk to Art, and they have about 56 contact tracers. So that's for him. He feels that that's pretty adequate. However, we're prepared if they need more to, of course, pump in the resources to make that happen. And we'll call all the social workers, because it's usually the social workers that are doing these contact tracing. And I have to say they're very good, and I don't believe it's because of me, because other people have experienced it also. That the contact tracers are very good. They call you, and they monitor you twice a day. And people have told me that. Now, I know people complain that they don't get the results right away. Sometimes it takes 2 to 3 days. I think if they don't call you right away, that's good, because that means you're negative, because they'll prioritize contacting people. And of course, they'll prioritize first with the positives. So I'm confident that if there needs to be increase in resources, whatever it is, equipment, space, people, cars, whatever, we're gonna pump that all in for them.
What about the government isolation facility? Because when Lillian was on yesterday, she mentioned that there was like over 40 plus people over at the Days Inn, and the capacity is up to 50. Is the government trying to secure another government isolation facility because of the surge?
Yeah. So the thing with the days in is they come in and out, right? So
Yeah.
if you're isolated for 14 days. So there's people still exiting the isolation um, hotel, and then people coming in. So we're watching that very closely. And the tag general is in charge of the all the isolations facilities and also the quarantine facilities. So we're monitoring it very closely, and so far we're still pretty good. But again, if we need to, we will get the facility, and we're in negotiations with other hotels also. So.
Gov, with the contact trace investigation into the people you've come into contact with, have they kind of run through that, or should we maybe ask Crystal that?
What was that again, Chris?
The status of the contact trace investigation into the people that you've come into contact with, has that been completed to your knowledge?
For my contact?
Yeah.
For my own contact tracing?
Yeah, the people that you've come into
Yeah,
contact. Yeah.
because you had events on
Yes.
Friday.
Right. Yeah.
Right. And there are people who got positive that were, they're not too sure whether it was from my contact or from other contacts, but I'm assuming it's from my contact because for all purposes, although I was negative on Wednesday, right? And they told me to self-quarantine, but I could just go to work and come back. And so on Thursday and Friday, when I went to work, I was very careful. But you could be very careful and still, you don't know. You may have touched your mouth, and then you touch things on the table, and it's supposed to be to live a certain amount of time. The virus, that's why you sanitize and all that, right? But no matter how careful you are, again, this disease or this virus is very contagious. It just takes one airborne virus that will affect you. And so, yes, I think they're all done with my contact tracing. And so now they'll have to do Josh's contact tracing and all the other ones that were positive as a result of maybe my contact tracing. And so that's how it works. And that's why we're so adamant about wearing your mask, because you could infect one person and then I'll infect 3 or 4 others, then they infect 3 or 4
You found the
others.
link?
I did.
Okay.
Sorry, we'd had public health still on here.
Dr. Manglonia hasn't logged off.
Right.
She's still showing.
We had also talked to public health about the community mass testing, and a lot of people are calling about mass testing, but they're saying that we're kind of shifting towards targeted testing. What are your thoughts on having another community mass testing, and do you think that would be an effective way?
Yeah, they are. I think they have 2 scheduled, one in late August and one in early September. I'm not too sure, but I did ask them to have more. But they do. But Chris, we need to, again, make sure that we, like you said, targeted testing, so we can identify those people that we know already have had positive contacts with someone that's positive. Yeah.
Gava, just because I know you're not feeling well, and we want to. How's your appetite?
I have an 8:30 meeting.
Right.
So.
Yeah.
Okay.
So just I guess, how's your son, and as a mother, what was that like, just dealing with knowing that your boy has COVID?
I know. I feel really bad for him. He hasn't gotten out of his room at his house. And he just says, he sleeps and he watches TV, and but he's doing better. He's doing okay. Thank you for asking.
Okay, Gov. Well,
any final words, I guess, for the people of Guam?
Just, I can't overemphasize. Do your part in containing this virus, and don't assume that everybody close to you is negative. Assume that they're positive and work accordingly. And thank you for everyone's well wishes and concerns and kindness and thoughts. Like I said, that was very encouraging and was very strengthening in my attitude and my healing over the last 3-4 days. So thank you. I appreciate it so much, and we will continue to protect our people. Thank you.
Thank you,
Thanks,
Gov.
Gov.
Eat your kadu.
Okay.
Okay, so wash your hands. There you go. Thank you, Governor Lou Leon Guerrero.
So she's going to be making some decisions.
Big decisions
Right.
today, guys. As you heard right there, and this is something we got a hold of late last night. They're anticipating. I mean, remember, they had report the data once a day. So you heard it there from the governor. 26 new positive COVID-19 cases.
Right. And she also said that she was discussing in discussions with John Fernandez or her team.